I am David Reich Hale, and this is 20-Minute Health Talk. Earlier this month, President Biden placed a focus on the White House's Cancer Moonshot initiative, which is pumping $1.8 billion into cancer research over 7 years. Money from the Moonshot initiative, which dates back to the Obama administration, has already flowed into more than 300 research projects nationwide. The Moonshot's goal is to cut cancer deaths in half in 25 years. To get there, however, specific research hurdles need to be cleared, according to experts, including the need to diversify clinical trials. Today, we are joined by Dr. Richard Barakat, Physician-in-Chief and the Director of the Northwell Cancer Institute. Dr. Barakat, how are you?
Good afternoon, David. Thank you very much for having me here today.
Absolutely. And we are also joined by Dr. Dave Tuveson, Director of the Cold Spring Harbor Lab Cancer Center. Dr. Tuveson, thanks for joining us.
Good afternoon, David and Dr. Barakat. It's my pleasure to participate today.
So, Dr. Barakat, the Moonshot dates back to 2017. And what has it meant so far for cancer research? And also, what does Biden's reinvigorating this mean?
Right. So the whole purpose of the Cancer Moonshot was really to accelerate the pace of cancer research and an effort to get scientists to work together more closely, to collaborate with each other, and to share data. And I think that's something that's extremely important. Scientists often are guarding some of their discoveries closely and may not be prone to sharing things until they've had a chance to publish it. And you see the benefit of when you work together and you share data. And I'll give you a current example. Take, for example, the production of the mRNA vaccines. Multiple companies were working on developing a vaccine for COVID-19, and those were developed in the period of 9 months, and that's not typical for vaccine development. So the same in cancer. If you have everyone collaborating, sharing data, working on sharing their information with as many people as possible, you're going to accelerate the pace of cancer discoveries. What the reinvigoration really signifies is a chance to come back together, unite, and continue this process. It's a wonderful goal to decrease cancer deaths by 50% by 25 years. But equally important, President Biden put a focus on cancer survivorship. Cancer patients have side effects. They have comorbid medical conditions. And we really want to take care of the entire patient in a holistic manner. Cancer is a big part of their healthcare problem, but it doesn't exist in a vacuum. There are side effects of treatment. They have other diseases that have to be cared for. So really, this represents a focus on taking care of all of those issues, or what's commonly known as survivorship.
And Dr. Tuveson, $1.8 billion are going into research. I think $1.2 billion of that has already been put out, but there's another $600 million earmarked through 2023. How does the money get to you?
Thank you, David, for this question. And so our country funds medical research as one of the amazing things that we do based upon the money we get from taxpayers. And so you pay taxes to keep your country safe from foreign invaders. That some of that money actually helps to keep us safe from health problems. And so tax dollars go to the National Institutes of Health, and they're distributed to the different divisions and branches of the NIH. And the National Cancer Institute is one of these branches. Now, the Moonshot money, which was earmarked during the presidency of President Obama, that is actually a special appropriation, which was passed by Congress. And so that's an additional bolus of resources that came through Congress, the $1.8 billion that you talked about, goes to the NCI, and then smart scientists and clinicians apply to work on the problems that Dr. Barakat talked about. And so Dr. Barakat talked about survivorship. And, many of these projects that were funded in the first time had to do with how can we get more survivors? Well, we get more survivors if we have better medicines, we have better therapies, and if we have better ways to detect cancer early or prevent it. And so many of the projects that happen were those topics and scientists across the country at medical centers and other higher educational institutes could apply for this money by having an idea they would submit in a grant application. It's like a term paper, but with reasons behind why you think your idea will stop cancer and make it a more tractable problem for the patients with cancer. And so, David, again, this is where our taxes really are working for the health of our citizens in this country. We are very generous, more than any country on the planet, in funding health research. That's the reason why in America, we actually invent the best medicines to fight diseases like cancer. Now, Dr. Barakat, my partner here in fighting cancer, will tell us we still have a ways to go because many of our patients are still sick. And so again, I hope this was not too long of an answer for all of you. Please pay your taxes. They're put to...
Well, so let's talk a little bit about the research that has taken place so far from Moonshot. Can you get into that a little bit? What are some of the accomplishments?
Sure. Yeah. So just like Dr. Barakat was mentioning, we have cancers where the outcomes when a patient is diagnosed with the cancer are not very good. So cancers like pancreas cancer, ovarian cancer, glioblastoma, which is a type of brain cancer. These are diseases where, unfortunately, most of the patients diagnosed don't make it. They lose to the cancer. The cancer defeats them. There were special earmarked funds for people to go after these really hard to treat cancers and ways to come up with new therapies and new ways to diagnose these diseases early. And so there was actually an effort which was called the pre-neoplasia project. Now that's like a wordy thing that won't roll off the tongue of many of you all out there. But again, cancer starts as a small process that you can barely see with your eyes. And usually you have to use a microscope to see it. And if you could find it when it's so small that your eyes can't see it, that's the time when doctors can really fix you. They can either operate on you and remove that piece of tissue, or they can treat you with medicines or even radiation to try to remove the pre-neoplasia. And if you can do that, you basically stop the disease before it starts. The problem we've always had is understanding pre-neoplasia. And so one of our big programs started, about 5 years ago now, was a pre-neoplasia atlas to assemble a dictionary of what does early cancer look like for these cancers I just mentioned and for many others, lung cancer, stomach, colon, breast, prostate, et cetera. That was a really successful investment. Many scientific findings were made that have influenced the care of patients today. And so that's just one example, David. There are many others. And it was very exciting, this sort of part one of the Blue Ribbon panel and this increased push for new ways to go after cancer. So part two is even more exciting because it puts the patient in the center. And as Dr. Barakat said, we now have some survivors. We'd like to keep people surviving forever.
So it's made a difference already then.
Oh, yeah.
Yeah, and I think, to Dr. Tuveson's point, these exciting developments, and that's just one of the many things that have been funded by the Moonshot program. One of the things that I really admire about the Moonshot program is that investigators who are funded by the Moonshot program have to publish their results in open access journals. So you don't have to pay for a subscription. And I think that's terrific so that all of that research is put out there.
There's research taking place right now, correct?
Yeah.
And where are we in that research? Is there something that we can focus on?
Well, I think when you're talking about research, just so that we are all on the same page, the most exciting developments and the best cancer outcomes occur with cancer clinical trials. That's where you take some of the incredible new drugs that are developed at places like Dr. Tuveson's institution, Cold Spring Harbor Cancer Center, where you come up with novel therapies that can then be translated from the bench, from the research lab, to the bedside. And it's been shown that the best outcomes in cancer occur with cancer clinical trials. Unfortunately, a small percentage of the cancer population actually enrolls in cancer clinical trials. And a big push is to get more and more patients enrolled in those trials. One of the big problems that we have, and it's really one of the, it's a major focus of the Moonshot Reignition, and President Biden has stated this, is that we have to improve access to cutting-edge cancer care to minority and underserved populations. Currently, when you look at the breakdown of populations of the United States, 13% are African American, 16% are Hispanic, but only 3% of the African American cancer population is on cancer clinical trials, and only 6% of the Hispanic population. And that's actually not good, because if you look at cancer outcomes, we know that there are disparities in outcomes, and that African American men, for example, are twice as likely to die of cancer than their Caucasian counterparts. We know that the death rate from prostate cancer is much higher in African Americans, from pancreatic cancer. We know that uterine cancer, which has become a very common cancer that occurs in women, is much more likely to have a bad outcome and result in death in African American women versus Caucasians.
And Dr. Tuveson, the Cancer Moonshot aims to lower mortality rate by 50% in the next 25 years. If that's reached, that's going to save about 300,000 American lives annually. That's a staggering number. Can we get there?
If we're able to follow the formula that worked for lung cancer and melanoma, then we have a chance of lowering mortality by 50% in 25 years. The challenge, of course, today is we don't yet have the way to prevent many of our cancers if we don't know what causes them. We have an obesity epidemic right now. Obesity is related to early onset diabetes, high blood pressure, and cancer of particular types. Intestinal cancer, liver, pancreas, breast, uterine are some of the tumors that are stimulated by obesity.
It's across the board.
Yeah.
Across the board. So identifying, so primary prevention would be eat differently, certainly eat less calories, but eat a healthier diet, have more exercise, try to lower the body mass index that humans have. That's possible. It would require a societal response, an individual driver, but the society would have to recognize this as a goal. Early detection. Well, this is where, again, new science, new research by clinicians and laboratory scientists is really crucial. We're looking for example, a blood test for cancer. And there have been advances in this space over the last several years. What Dr. Sharpless would like to do is really push that forward. And President Biden would like to do the same. Let's detect that cancer early. I think that'll be the right